Brain stroke or a brain attack, it is a neurological emergency which every person should know it, because time is a brain. Every minute delay here causes a death or permanent disability in life. So brain stroke or a brain attack is caused by an obstruction in a blood vessel in 80% of the time, or a rupture of a blood vessel in about 20% of the time. Whatever is the cause, once the brain is deprived of its blood supply, that area doesn't work. It is like a switchboard. If one particular switch is not working, that particular function will not happen. So when the brain stroke occurs, person develops some symptoms which everyone should know it. There is anything which comes sudden, that is sudden onset of one half of the body weakness, a hand or leg, or a slurring of a speech, or a change in the walking, or a sudden loss of vision. All these things are symptoms of acute stroke. So anything comes sudden, it is a stroke until otherwise it's proved. So rush to a neurologist immediately, because the only specific treatment for acute stroke is removal of the blood clot in right time. That is within first 4 to 6 hours. Whatever we do after 6 hours, it is only the prevention of the next stroke or the treatment of the complications of the stroke. So the clot which is obstructing the blood flow is removed either by medicine called TPA, or it is removed mechanically by a stent retriever. So brain stroke is an emergency. React quickly. Everyone with head will have headache during their lifetime. There are 200 types of headaches described. The most common and disabling headache is the migraine. Migraine, the headache can happen on one side or both the sides of the head or all around the head. It can last for few minutes to few hours, rarely even up to 2 days. The headache it may be very mild or it can be very severe. It is usually associated with a nausea, vomiting, sometimes with the irritation on looking towards a light called photophobia, or irritation while listening to loud sounds, a phonophobia. The migraine headache is triggered by certain factors in majority of the people. They include, like, suddenly if you don't have food in time, if you go to bright sunlight, you are not slept well around the periods, certain foodstuffs like cheese and Chinese food items, or food items containing serotonin like citrus fruits. Any age from childhood to adulthood, or even in elderly for the first time. But majority of the time it occurs in the young age group around 20s and 30s. Migraine has 2 types of treatment. One is, whenever you get a headache, for an immediate relief, the medicines like simple paracetamol, or a painkiller like a naproxen, or migraine specific medications like a triptans. If the headache episodes are more than 3 times in a month and they are disturbing your day-to-day activity, there are certain preventive measures like some medications, especially topiramate, divalproate, etc. These things are available. They reduce your headache episodes by 70 to 80% of the time. Of course, meditation and yoga are also found to be useful in reducing the frequency and severity of the headache. Other than the medications, identifying your triggers will help in you preventing these episodes further. When you should rush to a doctor immediately when you have a headache. These are called red flags. When any of these things are there, you should rush to the doctor immediately. First time headache in lifetime, very severe and intense headache. Headache in the elderly people with a cancer background, or headache with the fever, or headache which is increasing in severity, frequency, or any change in the character of the headache. Headache, if it is associated with a change in the vision, fits, or one-sided any weakness or numbness, you should rush to the doctor immediately.